Turning now to Health Watch this evening, many times a patient's medical condition is complex, and several doctors have to work together to make sure the patient gets the best possible care.
Shelley Botat introduces us to a man who credits his team of doctors for giving him a new lease on life.
Michael Fentress was overseas teaching when he fell out of a window. He broke his arm, leg, foot, and had a spinal cord injury. He was in a Czech Republic hospital for 3 months.
They operated on my back, but they just kind of splinted my arm and my leg. And so as the months went on, it fused into a situation where it was like this. So very big deformity.
Michael Fentress returned to Florida for rehabilitation.
No doctor would touch my leg.
So Michael depended on mobility devices.
I spent a lot of my time in the wheelchair, and it was pretty a depressing point in my life.
Michael then moved to Wisconsin to start a new life. He developed an infection, so he went to Aurora BayCare Medical Center and was referred to podiatric surgeon Dr. DeNamur.
He was actually walking on the side of his the outside of his foot and the outside of his ankle,
causing ulcers and an infection.
My job was basically to go in and remove the infected bone, which included a partial amputation of his right foot.
Dr. DeNamur knew they needed to do more or the infection could return.
If we don't do something, that there's a good chance he could lose his limb.
So Dr. DeNamur referred him to podiatrist Dr. Jason George DeVries, a foot and ankle surgeon.
He came to see me to talk about possibly fixing the deformity that kept leading to these problems.
Dr. DeVries performed an ankle fusion.
What we did is basically a realignment of the ankle and foot. We're trying to make the foot and ankle straight with the leg. And the way we did that is, the way I described it, was really an internal brace.
This team approach had Michael out of his wheelchair and walking with a cane.
We're both podiatrists and both come from different surgical training. You know, my training was pretty heavy in the diabetic limb salvage, which he's Michael is kind of like because of his neuropathy or nerve damage.
Michael says the doctors changed his life.
I'm grateful to those two gentlemen. I mean, they helped me to get a life back.
Michael now does volunteer work helping prisoners and finished his second master's degree, this one in mental health counseling. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat, Local 5 News.